Hi everybody, welcome back to Pathology 101. Today we're going to be speaking about cell injury and the different causes of cell injury. Injury occurs when the cell's adaptive capability is overwhelmed by stress, and we've already discussed the fact that the cells have a certain threshold of stress that they can withstand and adapt in response to it. If that stress is above the threshold or overwhelming the cell, then cell injury would occur. The likelihood of injury depends on the type of stress, the severity, and the type of cell affected. Now let's consider an example. If a plaque forms in a blood vessel slowly over time, then collateral vessels would form. Now you need to contrast that to a sudden formation of a thrombus. So the plaque ruptures and a thrombus forms, so you have complete occlusion of a vessel. Of course, that would be more severe, and that would, without the formation of collateral vessels, that would be more severe, and that would lead to infarction. However, the slow formation of atherosclerotic plaques and the formation of collateral vessels as well would lead to a less severe response by the cell. A cell could be reversibly or irreversibly injured, and we're going to discuss the difference between them in a separate video. So we've already been through this diagram. A normal cell in a steady state would achieve a new steady state via adaptation if the stress is below the threshold for injury. However, if the stress overwhelms the ability of a cell to adapt, then cell injury would occur. And as we said, there's reversible and irreversible cell injury. Irreversible cell injury would of course lead to cell death, which has two types, necrosis and apoptosis. Reversible cell injury, however, could go back to being a normal cell in a steady state, of course, homeostasis. So let's discuss the causes of cell injury. The most important cause of cell injury, the most common and most questioned cause, is hypoxia. Hypoxia is the decreased level of, it means the decreased level of oxygen at the level of tissues. Alright? And inflammation. Of course, inflammation is a very important cause of cell injury. Chemical agents and toxins, for example, cyanide, carbon monoxide as well. Trauma, of course, could cause cell injury. Nutritional imbalances, being under or over nourished, that could lead to cell injury. An example of that would be diabetes in obese people. So let's discuss hypoxia. Hypoxia is defined as decreased oxygen at the tissue level. Oxygen is crucial for the production of ATP via the electron transport chain. Now let's talk about the ETC for a little bit. So the ETC takes place in the inner mitochondrial membrane, and as we know, there are proton donors and acceptors, and oxygen is going to act as the final electron acceptor in the electron transport chain, and ATP is going to be produced via oxidative phosphorylation. And that's exactly why hypoxia causes tissue damage, because if you don't have oxygen, you do not have ATP, and many crucial mechanics that occur in the cell are disrupted. An example of that would be the sodium-potassium pump and also calcium channels. Alright? So let's discuss oxygen content. First of all, you don't need to know the formula. You just need to know the components, such as hemoglobin, saturation of O2, which means how saturated that hemoglobin is with oxygen, the partial pressure of O2, which means the dissolved oxygen in the plasma. And we could take this as sort of a pathway of oxygen that would make it easier to remember. So the PiO2 means the partial pressure of inspired O2 from the air. The P capital A O2 stands for the alveolar O2. And the partial pressure of O2 in the arterial blood is termed P small a O2. While the SaO2, the saturation represents the saturation of hemoglobin with oxygen. So the causes of hypoxia, that's very important. So hypoxemia, or hypoxic hypoxia, is the first cause, and it means the decreased partial pressure of O2 in the arterial blood. All right, and then you have anemic hypoxia, and that means that the hemoglobin is either decreased or simply unable to carry oxygen, and we're going to discuss that further on. Ischemic hypoxia is actually the most common cause of hypoxia, and it just means decreased blood flow to the tissues and therefore less oxygen. Histotoxic hypoxia is when the oxygen delivered to the tissue is fine, however the tissue cannot extract or use that oxygen due to the effect of some toxin. So we have hypoxemia, decreased partial pressure of O2 in the arterial blood. Anemic hypoxia, the problem is hemoglobin. Ischemic hypoxia, most common cause of hypoxia, it's caused by decreased blood flow to tissues. Histotoxic hypoxia, oxygen is just fine, tissues cannot use it. Alright? Let's talk about ischemia. As we said, it's the most common cause of hypoxia. So ischemia is the most common cause of hypoxia, and hypoxia is the most common cause of cell injury. Alright? Ischemia could occur due to decreased arterial blood flow or decreased venous outflow. Let's take a look at that. So if we have an organ, and this is the artery, this is the vein, and decreased arterial blood flow could be due to some sort of atherosclerotic plaque happening here or thrombus, and that would lead to decreased blood flow to the tissue. Decreased venous outflow could be due to a thrombus as well, and a prime example of that would be Budd-Chiari syndrome, very high yield, Budd-Chiari syndrome. And that's when the hepatic vein is occluded, and so that would lead to decreased blood exiting the tissues, and that would lead to a pressure increase in the tissues right here, and that would lead to decreased blood flow into the tissue as well. So just a side note here, the most common cause of Budd-Chiari syndrome is actually polycythemia vera. That's very high yield. Alright? So let's go back to decreased arterial blood flow as a cause of ischemia. It could actually be generalized or localized, and that's pretty important as well. Alright? Ischemia can lead to atrophy and infarction of tissue. So what is going to decide which one is going to happen? So it depends on blood supply. And what I mean by that is that some tissues have dual blood supply, for example the liver and the lung. So these organs have blood coming in from different sources, and therefore they are more resistant to ischemia. The occlusion rate of a vessel is crucial as well, because as we've mentioned before, an atherosclerotic plaque that's sort of getting bigger with time leads to the formation of collaterals, and that is actually milder when it comes to the amount of damage that it can do to the tissue, while an acute thrombus formation is catastrophic to a tissue and would lead to infarction. And the tissue's resistance to ischemia is the third factor. For example, very high yield, the neural tissue is actually very susceptible to ischemia. Alright? So let's move on to hypoxemia. Hypoxemia is reduced partial pressure of O2 in the arterial blood. Very important to know that. So just sort of set aside hypoxia as the most common cause of cell injury, and then sort of branch down from that into the causes of hypoxia. Alright? Hypoxemia, decreased partial pressure of O2 in the arterial blood. You have ischemia, and then anemic hypoxia, and we have histotoxic hypoxia. Alright? I know it's a bit confusing, but just sort of sit down and sort of put that strategy in place in that branching out diagram. Hypoxemia is reduced PaO2, so as a cutoff value it would be less than 60 millimeters mercury, and the saturation of O2 corresponding to that will be less than 90%. So what are the causes of hypoxemia? Number one would go for high altitude. And this could be thought of as a sequence, alright? So high altitude would lead to a very low partial pressure of O2 in the inspired air, alright? Hypoventilation, so I'm just achieving sort of a weaker effort to get all that air into the lungs, alright? Due to different causes, it could be neurological, it could be sort of structural, muscular, and thoracic as well, alright? So hypoventilation would lead to decreased partial pressure of O2 in the alveolar air, alright, so that's capital A. A diffusion defect would lead to, the PiO2 would be fine, the PaO2 would be fine, however, the partial pressure of O2 in the arterial blood would be low. It's a diffusion defect. An example of that would be interstitial lung disease and pulmonary edema as well. A perfusion defect means that the air coming into the lungs is just fine, it's reaching the alveoli just fine, and it's diffusing into the arterial blood just fine. However, there is less blood to receive that oxygen, and that would lead to a low saturation of O2 as well as a low PaO2. Alright? So these are the causes of hypoxemia. Alright? So high altitude would lead to decreased PiO2 and therefore everything else. Hypoventilation would lead to decreased P capital AO2. Diffusion defect, decreased PaO2, small a, and perfusion defect. So that is it. I'd like to thank you for tuning in, and if you have any questions, you can email me. We are going to discuss hypoxia, the other cause of hypoxia, in the next video.